Healthcare industry, Wikipedia audio. The healthcare industry is the range of companies and non-profit organizations that provide medical services, manufacture medical equipment, and develop pharmaceuticals. It includes the generation and commercialization of goods and services lending themselves to maintaining and re-establishing health. The modern healthcare industry is divided into many sectors and depends on interdisciplinary teams of trained professionals and paraprofessionals to meet health needs of individuals and populations. The healthcare industry is one of the world's largest and fastest growing industries. Consuming over 10% of gross domestic product of most developed nations, healthcare can form an enormous part of a country's economy. Healthcare in the United States is given by numerous different legitimate elements. Current evaluations put U.S. healthcare spending at around 15% of GDP, which is the most astounding on the planet. The United States spends the most noteworthy level of healthcare costs on pharmaceuticals on the planet. In the United States, around 85% of residents have health protection, either through their manager or bought exclusively. Backgrounds. For purpose of finance and management, the healthcare industry is typically divided into several areas. As a basic framework for defining the sector, the United Nations International Standard Industrial Classification categorizes the healthcare industry as generally consisting of. This third class involves activities of, or under the supervision of, nurses, midwives, physiotherapists, scientific or diagnostic laboratories, pathology clinics, residential health facilities, or other allied health professions, e.g. in the field of optometry, hydrotherapy, medical massage, yoga therapy, music therapy, occupational therapy, speech therapy, chiropody, homeopathy, chiropractics, acupuncture, etc. Exponentials will reshape healthcare by affecting territories, for example, manufactured science, 3D printing, and nanotechnology, and sidekick diagnostics among others. The Global Industry Classification Standard and the Industry Classification Benchmark further distinguish the industry as two main groups. The Healthcare Equipment and Services Group consists of companies and entities that provide medical equipment, medical supplies, and healthcare services, such as hospitals, home healthcare providers, and nursing homes. The latter listed industry group includes companies that produce biotechnology, pharmaceuticals, and miscellaneous scientific services. Other approaches to defining the scope of the healthcare industry tend to adopt a broader definition, also including other key actions related to health, such as education and training of health professionals, regulation and management of health services delivery, provision of traditional and complementary medicines, and administration of health insurance. A healthcare provider is an institution or person that provides preventive, curative, promotional, rehabilitative, or palliative care services in a systematic way to individuals, families or communities. The World Health Organization estimates there are 9.2 million physicians, 19.4 million nurses and midwives, 1.9 million dentists and other dentistry personnel, 2.6 million pharmacists and other pharmaceutical personnel, and over 1.3 million community health workers worldwide, making the healthcare industry one of the largest segments of the workforce. A developing accentuation on pay for result as opposed to pay for benefit, people in general private organization of Medicare Advantage, a procedure where government defines objectives, yet privately owned businesses go after participation and utilize diverse methods to control results and cost. The changing society and preparing of suppliers that looks more to underlying driver and long-haul results, a moving concentration from clinic-based care to care-given substitute settings. Tending to palliative care needs and end-of-life issues, a developing accentuation on entire individual care coordinated with mental and physical health. The medical industry is also supported by many professions that do not directly provide health care itself, but are part of the management and support of the healthcare system. The incomes of managers and administrators, underwriters, and medical malpractice attorneys, marketers, investors and shareholders of for-profit services, all are attributable to healthcare costs. In 2011, healthcare costs paid to hospitals, physicians, nursing homes, diagnostic laboratories, pharmacies, medical device manufacturers and other components of the healthcare system, consumed 17.9% of the gross domestic product of the United States, the largest of any country in the world. It is expected that the health share of the GDP will continue its upward trend, reaching 19.6% of GDP by 2016. In 2001, for the OECD countries the average was 8.4%, with the United States, Switzerland, and Germany being the top three. U.S. healthcare expenditures totaled $2.2 trillion in 2006. According to Health Affairs, $7,498 be spent on every woman, man, and child in the United States in 2007, 20% of all spending. Costs are projected to increase to $12,782 by 2016. General society and the members in the framework must teach themselves to the basic drivers of expenses and results, including social determinants of health. We should recognize that the present state of affairs isn't feasible in the long haul. The legislature all by itself ought not be viewed as the friend in need or a ultimate villain, yet a key factor in the development from healthcare to health results. Providers and professionals. The government does not ensure all-inclusive healthcare to every one of its natives, yet certain freely supported healthcare programs help to accommodate a portion of the elderly, crippled, and poor people, and elected law guarantees community to crisis benefits, paying little respect to capacity to pay. Those without health protection scope are relied upon to pay secretly for therapeutic administrations. Health protection is costly, and hospital expenses are overwhelmingly the most well-known explanation behind individual liquidation in the United States. The delivery of healthcare services from primary care to secondary and tertiary levels of care is the most visible part of any healthcare system, both to users and the general public. There are many ways of providing healthcare in the modern world. The place of delivery may be in the home, the community, the workplace, or in health facilities. The most common way is face-to-face delivery, where care provider and patient see each other in the flesh. This is what occurs in general medicine in most countries. However, with modern telecommunications technology, in absentia healthcare or telehealth is becoming more common. This could be when practitioner and patient communicate over the phone, video conferencing, the internet, email, text messages, or any other form of non-face-to-face communication. Improving access, coverage, and quality of health services depends on the ways services are organized and managed, and on the incentives influencing providers and users. In market-based healthcare systems, for example such as that in the United States, such services are usually paid for by the patient or through the patient's health insurance company. Other mechanisms include government-financed systems. In many poorer countries, development aid, as well as funding through charities or volunteers, help support the delivery and financing of healthcare services among large segments of the population. The structure of healthcare charges can also vary dramatically among countries. For instance, Chinese hospital charges tend toward 50% for drugs, another major percentage for equipment, and a small percentage for healthcare professional fees. China has implemented a long-term transformation of its healthcare industry, beginning in the 1980s. Over the first 25 years of this transformation, government contributions to healthcare expenditures have dropped from 36% to 15%, with the burden of managing this decrease falling largely on patients. Also over this period, a small proportion of state-owned hospitals have been privatized. As an incentive to privatization, foreign investment in hospitals up to 70% ownership has been encouraged. Medical tourism is the rapidly growing practice of traveling across international borders to obtain health care. Such services typically include elective procedures as well as complex specialized surgeries such as joint replacement, cardiac surgery, kidney transplantation, liver transplantation, dental surgery, and cosmetic surgeries. However, virtually every type of health care, including psychiatry, alternative treatments, convalescent care, and even burial services are available. As a practical matter, providers and customers commonly use informal channels of communication connection contract, and in such cases this tends to mean less regulatory or legal oversight to assure quality and less formal recourse to reimbursement or redress, if needed. Over 50 countries have identified medical tourism as a national industry. However, accreditation and other measures of quality vary widely across the globe, and there are risks and ethical issues that make this method of accessing medical care controversial. Also, some destinations may become hazardous or even dangerous for medical tourists to contemplate. Delivery of services. Medical tourism. Open and private health frameworks have been confronting income weights and declining edges for quite a long time. The pattern is relied upon to persevere as expanding request, framework redesigns, and restorative and innovation headways strain the officially constrained monetary assets. Subsequently, spending is required to be driven by maturing and developing populaces, creating market extension, clinical and innovation advances, and rising work costs. As healthcare costs increment, however, moderateness and protection scope stay dangerous. Healthcare suppliers are additionally teaming up to increase upper hand. Healthcare issues. 1. Creating a positive margin in an uncertain and changing health economy. Changing trends in health industry. Recommendations. 2. Investing in exponential technologies to reduce costs, increase access, and improve care. Exponential advances are driving more affordable, more effective, and more open care conveyance on a worldwide scale. A couple of patterns which affect care conveyance are: in any case, there are pockets of development that can be the main edge of changing the U.S. framework. Some of these include: to accomplish this brighter future, a few things are required.